would like to invite Dr. Rosanna Marsella for the next lecture on approach to diseases to pigmentation. Please enlighten us with your wisdom. Thank you.
That affect pigmentation. Once again, this is my email. If you have any questions, cases, desires for the future, shoot me an email. All right, so before we talk about the diseases, I think it's helpful to think about the cells that are affected in it, starting with the melanocytes. So melanocytes are responsible for the production of melanin, and they sit right on the basement membrane. This is a key point, because any disease that will affect the basement membrane will potentially affect pigmentation. So melanocytes on an H&E, they look like clear cells. This is a melanocyte. So it's not a pigmented cell, it's a clear, not the melanocytes. So all these cells here are actually keratinocytes that are receiving the melanin from the melanocytes. The melanocyte is this one, okay? So the clear cells here, there's a melanocyte. And all the other pigmented cells are actually keratinocytes. Okay, so anytime I have changes of pigmentation, it can result from a variety of factors. Either the number of the melanocytes has changed, either the production of the melanin has changed, as well as their ability to transfer the pigment to the keratinocytes, or it has been a damage of the basement membrane, therefore the pigment has dropped below the basement membrane into the dermis. It's called pigmentary incontinence, okay? But the important thing, as in this picture, is that you have the melanocyte, which is a dendritic cell, that basically has all this ramification called dendrites, and they give the pigment to the keratinocytes. Typically, the ratio between the keratinocytes and the melanocyte is 40:1, okay? So those are kind of like basic foundational facts to think about before we talk about diseases. The other thing to consider is how melanin is produced. When we talk about melanin, it's not one molecule. It's a family of molecules. And they range from the dark pigmentation, which is called eumelanin, which is basically the black color, all the way to the red color, which is the pheomelanin, and everything in between. Okay, and so most animals or people are a combination of eumelanin and pheomelanin, and it's the gradation of colors. But the key things to consider out of the slides are two. One is the enzyme that is responsible for melanin production, which is tyrosinase. Two is copper. Copper is a coenzyme that is critical for melanin pigmentation. So if you have a copper deficiency, you're going to have hypopigmentation or depigmentation. And if you have issues with tyrosinase activity, whether they're acquired or congenital, you're going to have issues with pigmentation. Okay, so let's start with diseases that present with hyperpigmentation. Like I said, it could be an increased number or an increased production. What are examples of that? Okay, one could be a metabolic endocrine disease, and we're going to look at some slides. The other one, most common, is post-inflammatory. The skin has very limited ability to react to irritations. Like I said, one is endocrine diseases. So the classic examples are hypothyroidism, Cushing, hyperestrogenism, like dogs with Sertoli cell tumor. Yesterday we saw cases of that, or alopecia X. And as Dr. Torres told you earlier, hypothyroid dogs can get that hyperpigmentation on the bridge of the nose. that is kind of like very distinctive for hypothyroidism. But the other diseases, the bulk of the endocrine diseases are truncal diseases, right? So they spare the head and the legs, and you have this truncal alopecia, many times associated with hyperpigmentation. And in these cases, the skin is not thicker, it's just hyperpigmented, okay? So that's example of metabolic endocrine type diseases, right? So this again are pictures of hypothyroid dog where you have alopecia and hyperpigmentation on the bridge of the nose. Okay, sometimes people are concerned, they think it's melanoma, but there's no need to biopsy these dogs, okay? Submit a thyroid panel, okay, as we learned today. Another option or possibility is a seasonal flank alopecia, which is not really under the umbrella of endocrine diseases. But there's some breeds of dogs like boxers, bulldogs that develop this symmetric, many times symmetric alopecia on the flanks with hyperpigmentation. The skin, many of them are non-itchy unless they get a secondary infection, but they lose the hair and they are hyperpigmented. This typically occurs in the time of the year when the days become shorter. So for, the Northern Hemisphere, that's the winter. Okay, and this is thought to be linked to changes in melatonin and prolactin. That might be responsible for this disease. Okay, so clinically speaking, when I am presented with anything like I showed you, the bulldog, the boxer, that has that, first and foremost, as a clinician, I want to make sure that I rule out the most common stuff, right? So hypothyroidism, would be a consideration because they're larger dogs, and so on, before you start going, saying, okay, this is seasonal flank alopecia. Some clinicians supplement these dogs with melatonin, and half of them tend to improve. Some don't, okay? Some will regrow their hair in the summer months, and some will not. Another option, like I said, is post-inflammatory hyperpigmentation. So in these cases, you typically have lichenification, so the skin gets thicker and it gets darker. And these are typically allergic dogs that have been itchy for a while, and then the skin, reacts that way. It can be focal, it can be generalized, and this is typically something that we see in dogs, not so much in cats. People, sometimes the owners will ask you and say, will this ever get back to normal? Well, my reply to them is, how many years did it take to get to this point? Count at least half of them to get better, okay? Because this is something that has developed over time. It's almost like a chronic pathological change of the skin. So that hyperpigmentation does not disappear overnight. And so the classic example is the dog that has been licking for a long time, has had bouts of pyoderma, or like the one here on the right that has a mixed pyoderma malassezia. So you have this thicker, greasier, darker skin. Those are by far the most common cases, right? These are all allergic cases. Westies are the poster child for yeast infections, very itchy, and they get hyperpigmented. We talked about the cytology yesterday and different techniques on how to do cytology. Some of the thicker skin, try the dry scrape, not just the tape, and compare the number of bacteria and yeast that you find using the different techniques. But sometimes you can have hyperpigmentation without the lichenification. This dog had dermatophytes, and it was hyperpigmented, but the skin was not thicker like the allergic dog I showed you. Now, other category of disease, like I said, it could be genetically inherited. And the example I picked is the Siamese. They have acromelanism, where the activity of the tyrosinase is temperature dependent. So it's more active when the temperature is lower. So the lower temperature is the extremities. So that's why they have darker hair, tip of the ears, tip of the tail. And if you were to clip those cats, you know, initially the hair grows back darker because the skin is basically being naked until it kind of goes back to the more cream colored that is normal for them. So this is a genetically inherited activity of the tyrosinase. Then there are other examples of hyperpigmentation. They're benign. So basically the freckles, right? So we saw a dog yesterday that had lentigo, and so older dogs tend to get all these darker spots, just like people, and it's visible where they have less hair. You can also have this in orange cats, that they get it on their nose, and they may get it on the tip of the ears, easier places on the lips. These are benign changes. That's who they are. Sometimes people are concerned. You know, they will ask you, is this melanoma? No, this is normal, benign change for that color of that individual. Again, some breeds of dogs have these spots, and that's normal to them. So these are all genetically inherited changes of the skin associated with hyperpigmentation. So how do you decide? Well, you look at the skin. There is no inflammation. There is no ulceration. And, you know, basically they are completely asymptomatic. So basically there's no treatment. And really, I don't biopsy these cases, even when people kind of ask you to do that. But it's your comfort level, how you go about it. Just be aware that these are possible presentations. Now, on the other side is loss of pigment, hypopigmentation, and I'm going to cover both leukotrichia, which is when the hair gets white, as well as leukoderma, when the skin gets white. These two dogs are example of vitiligo, okay? But I'm going to talk about things also besides vitiligo. All right, so let's start with the normal stuff. So puebaldism is something that is a genetically inherited trait in some breeds, like Dalmatians, and so it has to do with the actual absence of the melanocytes in some areas of the skin. So if you were to biopsy and do special stains looking for melanocytes, that they're absent in their white spots, okay? Other possibilities, albinism. In this case, you do have the melanocytes in the skin, but they are not producing pigment, and the issue is a tyrosinase deficiency. Okay, so again, it's the enzyme that is responsible for the production of melanin. Another possibility is the Chiadiac-Hidashi syndrome, that basically is not just a mutation that has to do with the hair color and the kind of the mutation so that they have this diluted color. But these individuals also have immunodeficiency, they have bleeding issues, so the coloration that they have is almost like a key to look for other issues. So I put a picture of where you have the affected and the non-affected. So the light color here is the affected one. So they have the silvery, lighter color. So that's a pathological condition, not a normal presentation. The other one is a disease of the Waardenburg syndrome, where you have a defect in the migration of the melanocytes. This we see quite a bit in the clinics. I think it's important to educate owners that these dogs that have this blue eyes and this white color, they're also deaf, because melanocytes are present in the skin, in the inner ear, and in the eye. So the fact that they don't have melanocytes in the inner ear makes them deaf. So it's important for owners to be educated on how to deal with these dogs and develop some form of training based on hand signal, since the animals cannot hear. It's a dominant trait, so these animals should not be bred. Then another possibility is vitiligo. So vitiligo is an immune-mediated disease where you basically, the melanocytes are targeted, but compared to other immune-mediated disease, it's largely asymptomatic in the sense that you don't have other clinical signs that are associated with the classic immune-mediated disease. What you do see is leukotrichia and leukoderma. So they lose pigment in the hair and on the skin, but the skin itself is normal. You don't have ulcerations, you don't have loss of normal architecture. There are some breeds of animals that are prone to it, Dobie's, Rottweiler for dogs, and Siamese for cats. So the first thing that people typically notice is on the nose and the lips. And so if you pay attention to these pictures and the type of the pigmentation, you will realize it's kind of like a benign depigmentation compared to some others that I will show you later. It's either like a white or kind of like a pink color. As opposed to what we would see with true autoimmune diseases like VKH and so on. So it's basically most of the time we don't biopsy these cases because it's a benign disease, but sometimes owners will request a biopsy to confirm that it's truly vitiligo. So look at this nose, right? This Rottweiler. It's just basically a very benign, non-inflammatory loss of pigment as opposed to the gray, discolored nose of the older dog that has lymphoma. They look very different. Although they both have the pigmentation, it's a different look to the depigmentation. Okay, so they can lose pigment again on the nose, lips, foot pads, toenails, hair, and it's progressive in some individuals, yet a benign disease. So this is kind of like the classic image, right? So non-inflammatory, non-ulcerated. It's a cosmetic disease, and I have never had any that would revert back to normal, okay? So it's basically a permanent condition. Now, different situation is the uveal dermatological syndrome. Okay, this also is an autoimmune attack to the melanocytes. These animals, however, develop uveitis as well as skin disease, skin depigmentation. So it's also a progressive disease. So dogs will basically depigment starting at a very young age, progressively. Some of them become completely white at a very young age. But they do have ocular disease. It's not just the skin and the nose and the lips that is getting depigmented. They get uveitis. And as you see, this nose is, yes, depigmented, but also is ulcerated. And then they eventually get crusting and so on. So it's a completely different presentation. So you have depigmentation of the skin, but you also have ulcerations. It's inflammatory. You have ocular disease. So sometimes the skin starts and the eyes come later. Sometimes the uveitis is the very first thing that these animals develop, but it's very important if they come to you because they have skin disease first, that you immediately think of the syndrome, you make a prompt diagnosis and immunosuppress these patients to kind of prevent or minimize the impact of the uveitis. Okay? Because that's the single most important part, is not so much the skin, is to save the eyesight of these dogs. Okay? And again, like I showed you before, you have the nose is affected, the lips are affected, so it's a facial disease, but it can progress to the rest of the body. So autoimmune attack of the melanocytes. Those lips, if I have to put differential diagnosis for these lips, I think of an autoimmune disease. I don't think of vitiligo. I could be thinking of discoid lupus. I could be thinking of VKH. I could be thinking of another bullous autoimmune disease. So my list of differential diagnosis will be different. Again, this is the same dog, how it basically progressed over time. It started with an inflammatory dermatitis, periocular on the face, and then affected the nose, and then eventually got completely white. So this is a dog where we were able to save the eyesight, so at least initially, but had developed leukotrichia. And this is the same dog years later, where obviously the immunosuppressive regimen failed, and so had to go to surgery. And so here we are. So to summarize, one differential diagnosis for depigmentation is VKH, is associated with acute onset uveitis. Sometimes, like I said, skin starts first, sometimes the eyes. And it's very important to have a prompt diagnosis, take a biopsy, and then immunosuppress these patients to minimize the ocular diseases. If you were to make your list of differential diagnoses, you could be thinking of other autoimmune diseases, but truly once you have the uveitis and the skin disease, there is nothing like it. So you can pretty much bank on the fact that it's VKH. Now, like I said at the beginning, melanocytes sit on the basement membrane. So you can have hypopigmentation in different mechanisms. So anytime there's a damage of the basement membrane, you have hypopigmentation or depigmentation as a side effect. So it's not a direct attack of the melanocyte, it's an attack of the basement membrane. So what are the possible diseases that do that? Discoid lupus is the first one that comes to mind. So lupus is the basement membrane is involved and is cutaneous. So you don't have systemic sign. It's just limited to the skin. It's typically a facial disease. So the nose, sometimes around the eyes. But basically you have depigmentation of the nose, the lips, and then eventually they get ulcerations and crusting. But the depigmentation is the first thing that happens. So if you have an owner that is attentive and you ask them what started first, it should be depigmentation. Different from the pemphigus dog, in which the first thing that starts is the crust. And then when the scabs fall, then you have depigmentation as a consequence, but it's not the primary event. The primary event is the pustule, therefore the crust. When the crust falls off, you have depigmentation. Either way, they're both autoimmune diseases, and both patients will require some form of immunosuppression. Right? But this is an early case of DLE where you have the inflammation of the skin around the nose before it gets to the nose itself. And this is the classic depigmented nose due to basement membrane damage. Do you see that this is a gray looking nose, right? So in this case happened to be DLE, but in another dog could have been MF, like cutaneous lymphoma. Why? Because when you have lymphoma, you have all these lymphocytes that migrate through the basement membrane, and so you have collateral damage of the basement membrane, therefore you have pigmentary incontinence, so loss of pigment. But basically, both diseases have that gray-looking nose, and then, of course, the ulcerations and the loss of normal architecture. Right? So these are all discoid lupus cases, some more inflamed than others. Okay, but basically the key here, if you don't do anything about it, eventually the total architecture of the nose is impaired and demolished. So even if it's a localized disease, it can be locally very severe, and it can be quite painful. So when I have cases like this, you can make your list of differential diagnosis. Mucocutaneous pyoderma and DLE sometimes can look very similar, and so people kind of confuse them, but one is a bacterial disease, the other one is an autoimmune disease. If you have ocular disease, definitely VKH is your top differential. If you have a collie, think about dermatomyositis as a possible differential diagnosis. How do you go about it? Biopsy. Regardless of what you have on your list, once you've done your cytology, you end up biopsying all these cases, whether it's dermatomyositis, VKH, DLE, pemphigus, it doesn't matter. You end up doing a biopsy of an area that is not ulcerated, where you want to basically identify the kind of autoimmune disease that you have. If you have discoid lupus, then you want to make recommendations to avoid UV exposure, and then depending on the severity, you may treat it topically in benign cases or systemically in more severe cases. And it's typically a combination of an immunomodulatory / immunosuppressive regimen. So the immunomodulatory is more like tetracycline niacinamide, which we would use for milder cases, and the immunosuppressive would be high doses of steroids with a steroid-sparing agent for the ones that are like ulcerated and aggressive, at least for the first couple of weeks until you kind of induce some remission. Now we're moving to neoplastic. So you already heard lymphoma many times tonight. It's very common where I practice because allergies predispose to lymphoma. And so we see a lot of allergies in Florida, so we see a lot of lymphoma. And so if you ask yourself, how is it that allergies can predispose to lymphoma? The simplest way I can explain it to myself is that atopic dermatitis, which is environmental allergy, is a disease of chronic lymphocytic stimulation. And these lymphocytes are stimulated for years and years and years, eventually go from inflammatory to neoplastic. And so dogs that have chronic allergies are at higher risk of developing lymphoma when they get older. So this is a lymphoma nose where you have that kind of depigmentation. You also see that it looks inflammatory. It doesn't look like the vitiligo nose. Right, these are different, again, presentation. The one on the top, they're basically two different stages of the same patient where it kind of progressed from a more benign depigmentation to a more widespread depigmentation. The one on the bottom row is kind of like already angry, inflammatory, crusted. So if you have an older dog that has depigmented lips and nose, take a close look in his mouth and kind of like if things don't respond how you would expect, consider a biopsy to rule out lymphoma. But talking about more benign conditions, there are some dogs that just simply get this depigmented nose and is a benign change. Labradors are notorious for that, and they just get this pink nose. And it's kind of like if you're a show dog, that's not good, but otherwise it's a benign cosmetic thing, is no disease. So look at this color. This is basically a brown nose, right? So in dogs they're otherwise kind of like cream colored. So it's very different from the gray looking nose of a dog that used to have a black nose. So again, you can go through your differential diagnosis, but I don't think most of these cases would warrant a biopsy. It's basically you consider the segment and the clinical presentation. Now, let's look at changes of hair color. So some we already talked about, vitiligo, right? So that basically both vitiligo and VKH, you have this progressive leukotrichia. So the hair is prematurely gray. But there are other possibilities. One is the oreotrichia, which is a very rare condition, but it's been reported in schnauzers that they kind of develop this gold type color. and is a transient color. Many times it resolves spontaneously as a genetically inherited condition. You may come across some of these patients, and it's basically is something that runs in families, but it's not pathological per se. And so again, it's kind of like they may look funny, but it's kind of benign otherwise. Another situation that I'm sure you will see much more commonly is sebaceous adenitis. We'll talk more about sebaceous adenitis when we talk about crusting diseases, because it's something that presents with scaling and so on, but in simply explained terms, is an autoimmune disease where the sebaceous glands are attacked. And as a consequence, you have changes in sebum production, changes in keratinization, and changes in structure and color of the hair in some breeds. So sebaceous adenitis you'll see in poodles as well as other breeds, but in poodles, it will change many times the structure of the hair. So the dog on the bottom, these are siblings, the dog on the bottom has sebaceous adenitis, so the hair, the first thing that happened in that dog, the hair lost its curls. So it got straight and it got darker. And that was the very first thing. And then eventually got the crusting, the scaling, the hair loss. So if you have a poodle and they bring it to you because the hair has changed in structure and color, think about sebaceous adenitis. And the only relevant thing would be if the animal is intact, to advise the owner to basically not breed that patient. You can biopsy to confirm it and to basically advise against breeding so that you don't have more sebaceous adenitis dogs. Now, another possibility is a dog that is not shedding its coat as frequently as it should. So this is the poster child for hypothyroidism, as we learned today, right? Obesity and all that. And thyroid hormone is important to start anagen phase in the hair, so new hair growth. So if you are hypothyroid, then you don't renew your coat fast enough. And this dog did not lose his coat, it just simply did not renew it. So eventually it kind of got bleached and of a different color. Okay, and then of course has a sign of being chunky and all that. But basically bleaching can be a sign of the hypothyroid patient. Other situation for changes of hair color is salivary staining and tear staining, right? So the salivary staining is the allergic dog that is basically licking and has been licking for a while. And so this has to do with the porphyrin that is present in the tear and the saliva. And so owners will be concerned about, what that means and what can they do to minimize that. So boric acid is helpful to remove the staining, and so is baking soda. These are kind of home remedies to consider, or at least to advise. They're very benign. And of course, if they're licking their feet, the next thing is to do something about it, right? And so many of these dogs that have that reddish discoloration and they focus on their nails, many of them have malassezia on their feet. Okay, and they have it in their nail bed. So dogs are not like people that behaviorally we tend to pick our nails and bite our nails and so on. When a dog starts biting his nails, it's typically because they are itchy and they have an infection. And you'll see those discolored nails that turn from white to a rusty color. And so that's Malassezia paronychia. So these are good cases to do cytology. You can stick a tape in the nail bed of those dogs, stain it, look for Malassezia. In my experience, these dogs typically need systemic treatment with antifungals. It's hard to treat them topically. Many of them would need, in my experience, either itraconazole or terbinafine. Because when you select your antifungal, you will select antifungals that have the ability to accumulate in the nails. So if I have to look at all the different azoles, itraconazole is the one that has the longest persistence in the skin and hair. And if you don't want to use an azole, then terbinafine is the other option. So to summarize, we have looked at different examples of changes of pigmentation, ranging from the benign pigmentation, that changes that could be genetically inherited or acquired, like a vitiligo, all the way to much more serious diseases. So the way to go about it is, once again, to consider your history and your signalement. Am I dealing with what breed of dog or cat? Am I dealing with what is the age? Do I have any other systemic signs? How does the skin look like? Does it look inflamed? Does it look ulcerated? Do I have any other change in the structure and the normal architecture? And kind of so that you can rank your diseases. If you have ocular disease, basically you have to think of VKH or uveal dermatological syndrome, and you need to be prompt in your diagnosis of treatment to save the eyesight of these dogs. And so regardless of the autoimmune disease that you will consider, you end up biopsying all these cases. And since the diagnosis is in your epidermis and basement membrane, you want to make sure that you biopsy an area that is not ulcerated, okay? So this is basically my short version.